nurse today.
James Adams.
Nice to meet you. May I just check your armband real quick? Alright, James Addison, February 2nd, 1960. Perfect. Before I start asking you some questions, I'm just going to wash my hands real quick. Alright, so today I'm just going to be asking you some questions regarding your vision and lifestyle before your eye examination. Do you have any questions before we begin?
No.
No? Okay, let's get right into it then. Have you had any recent changes in vision lately?
Yes, I have noticed that my vision has become blurry within the past few weeks, and this has caused me to have difficulty driving, especially at night.
Oh, okay. With this vision changes, have you noticed spots or floaters in the front of your eyes, or blind spots, halos, rings around lights?
Yes, I have had some cloudy spots in the center of my vision, and I haven't noticed any rings around lights, and the only blind spots are the blurriness I've experienced.
Okay. So you have any eye pain with that includes like redness or swelling around the eyes, or excessive watering or tearing or other forms of drainage from the eyes?
The only pain I have is these bad headaches, but nothing else.
And let's jump into some past history. Have you had any previous eye or vision problems, or taken medications, had surgeries, laser treatments, or used corrective lenses?
I just wear my glasses regularly, and I haven't had any surgeries, no laser treatments, and I don't bother to use contact lenses.
Alright, let's talk about some of your family history of eye problems or vision loss.
Both of my parents wore glasses and also saw doctors about vision problems when they got older, and my mother always complained that her eyes were getting worse the older she got.
She did, okay. And let's talk about some personal lifestyle and health practices now. Such as, what kind of work do you do? Are you exposed to chemicals, fumes, smoke, dust, flying sparks?
I've been working in an auto parts factory since my early 20s, and I work in the plant and behind a desk for most of the day. And there's a lot of dust, sparks with the machines I work on, and we also test the products or have machine malfunctions that can lead to smoke and fumes in the building.
Really? I see. So do you use safety glasses or regular sunglasses during normal day-to-day activities?
Well, when I first started working there, we didn't have them available, but as the companies progressed, they're mandatory, so I use them daily. And sunglasses I wear in the summer and sometimes when I drive, but not always.
Okay. And do you take any regular prescription medications?
For the past 12 years, I've taken medications to control my blood pressure. And I've been a diabetic since I was 8, and I take my insulin injections regularly.
Well, that's good to hear. How about the use of over-the-counter medications like aspirin or ibuprofen, Advil?
No.
How about any herbal remedies, like anything natural, like tea or anything like that? Or
Nope.
Okay. And has your vision loss affected your ability to work or care for yourself or care for others?
I've been nervous to drive, so getting to and from work has been a little challenging, and tasks at work are becoming more difficult. And I don't have to care for my children or my wife anymore, so that's fine, and self-care has been okay.
Okay, I see. And can you tell me the date of your last eye examination?
Around this time last year, I had a checkup.
Oh, okay, good. And while you work in the factory, are you exposed to any loud noises? And if so, do you use your proper ear protection?
When I'm in the plant working with the machinery, they are very noisy, but things are quiet at home since my daughters have left for college, but I do try to wear the earplugs as much as I can.
All right. That concludes the questions I have for you today. Do you have any more questions or concerns that I can help you with?
No, I think we've covered everything.
Okay, thank you so much for answering these questions. I'm going to document this information into your file, and when I have another nurse come in and perform some quick eye tests for you to check your vision currently, and she will be with you momentarily. Thank you so much.
Thank you.
Hey, Kaylee.
Hey.
I just collected some subjective information on Mr. Adamson. I just wanted to update you prior to going into your physical assessment.
Okay, what did you find out?
Well, during our interview, he stated that he's been experiencing blurred central vision for the past few weeks and very bad headaches. He does have a history of hypertension for the past 12 years and takes prescribed medications to control it.
Okay.
And since he was 8 years old, he's been a diabetic, but he takes his insulin injections regularly.
Okay.
He states that he takes his prescribed medication as stated, but he still has been having higher than usual blood pressure readings.
Okay.
I did have a nursing assistant go in prior and take a full vital set, and it revealed that he was still 150/90.
Okay.
I did come up with some possible nursing diagnoses, though, and I'd like to discuss them with you,
Sure.
such as disturbed sensory perception related to visual impairment, as evidenced by blurred central vision, and ineffective health maintenance related to knowledge deficit, as evidenced by failure to take protective precautions, such as wearing safety glasses, ear protection, and sunglasses.
Right.
Okay, those are some really good possible nursing diagnoses. Let's see what the physical assessment reveals, and then we can try to determine some possible interventions for Mr. Adamson.
Okay, thank you so much.
No problem.
Come in.
Hi, my name is Haley. I'm going to be the nurse doing the physical portion of your eye assessment today. Can I see your brace, please? And your name and your date of birth?
James Adamson, February 2nd, 1960.
All right, thank you. I'm going to wash my hands real quick. We're going to be doing some tests today. I'll explain them as we go. Just let me know if you have any questions, all right? The nurse begins this assessment with a visual acuity test. This involves the patient identifying letters on an eye chart from 20 feet away to test their distant vision. Can you remove your glasses for me, please? All right, thank you. Can you read the first line?
E.
All right, the second?
C. J.
And the third?
D. E. L.
And the fourth?
L. I. N. G.
And the fifth?
I can't read that.
All right, so according to the chart, your vision is 20/50. 20/50 is an abnormal finding and is considered myopia, which occurs when the second number is larger than the first. This means Mr. Adamson is experiencing impaired far vision.
In this test, the patient covers one eye with an opaque card. The examiner stands facing the client, arm's length away, and extends their arm, bringing it inward until the client can see it.
All right, cover your right eye with this card, please, and tell me when my finger comes into vision, okay? Now. Okay, another eye. Now. Okay, good.
Visual field tests can detect dysfunction in central and peripheral vision. The visual field refers to the total area in which objects can be seen in the side vision while focusing on a central point.
The client looks straight ahead while the nurse shines the pen light towards facial midline. Now I'm going to test your corneal light reflex with my pen light. Can I have you remove the glasses, please? All right, look straight ahead. Good. The reflection of light should be located in the same place on both eyes.
The client must look straight ahead while covering one eye with an opaque card.
I'm going to have you cover your right eye with this card, please, and look straight at that wall. Now remove the card. Can you cover your left eye? And remove the card. Good.
The cover test is used to detect deviation in alignment or strength of eyes. The uncovered eye should not move. When the card is removed, the previously covered eye should not move as well.
The patient focuses on an object the nurse is holding and follows it through the 6 cardinal fields of gaze. I'm going to have you follow this pen with your eyes to test your extraocular muscle movements, okay? Good. Both eyes should move in a smooth, coordinated manner in all directions. Now I'm going to begin inspecting your external eye structures. Can you look straight ahead of me, please? The nurse should assess the eyelids and lashes, then the positioning of the eyeballs. Next, the nurse should test the oculomotor nerve by having the client close their eyes. The nurse should inspect the conjunctiva and sclera for clarity and appearance, as well as the cornea. The iris and pupil should be inspected for shape, color, and equality. The nurse should palpate the lacrimal apparatus for response to pressure and discharge.
Have the client look straight ahead while the nurse approaches each eye from the side with a pen light.
I'm going to check your direct pupil response to my pen light. Can you look straight ahead, please?
Pupil should constrict with the presence of light. Also, the pupil of the opposite eye should constrict consensually. Ask the client to stare at an object the nurse is holding from 3 feet away, then move the object in towards the client's nose.
Look at this pen for me, please, and follow it as it gets closer to your nose.
Pupil convergence and constriction should be uniform.
Good. Look straight forward, please. Inspect the red reflex by using an ophthalmoscope to shine the light beam toward the client's pupils. Normally, a red reflex is easily seen and should appear round with regular borders. To inspect the optic disc, rotate the diopter setting until the retinal structures are in sharp focus. Observe the disc for shape, color, size, and physiologic cup. Next, inspect the retinal vessels, retinal background, fovea, and macula for color and presence of lesions. And lastly, inspect the anterior chamber for transparency. All right, Mr. Adamson, after our assessment, we've decided to refer you to an ophthalmologist in order to further explore your recent vision changes and to see if they're related to your headaches. Also, we're going to refer you to a dietitian to help you develop a diet rich in vitamin D. And lastly, you should make an appointment with your primary care physician to see if changing your hypertension medication will help you maintain your blood pressure.
We'd also like you to avoid driving at night or if you have any experiences with blurry vision again, just for your safety. But we'd also like you to make up a checkup appointment just to see if any of these recent vision changes start progressing.
Any more questions?
No, I think you've been very helpful. Thank you.
Thank you.
for coming in.
Have a great day.
You as well.